I'm Dan Collins with Mercy Medical Center in Baltimore, Maryland, and you're watching Medoscopy. On December 12, 2019, a cluster of patients in Wuhan, China were reported experiencing fever and shortness of breath. By March 2020, U.S. states would begin shutting down as all non-essential workers were advised to stay home to slow the spread of the SARS-CoV-2 virus, better known as COVID-19. Today, we welcome to the Medoscopy set two very essential people for Mercy who have played and continue to play a significant role in the hospital's COVID-19 response. Dr. Wilma Rowe, Senior Vice President of Medical Affairs and Chief Medical Officer, and Jessica Hagner, Board-Certified Physician Assistant and described by Dr. Rowe as the clinical point person for all things COVID at Mercy. Thank you both for joining us today. Dr. Rowe, take us back. When did you first hear about COVID-19, SARS-CoV-2? When did you realize the sort of impact it was going to have?
I think I first started hearing about it very late December, and we started watching and preparing as early as January of 20. And but the day that it really hit me was February 28th, one of those days you will always remember. And that was the day that there was the first case in the United States that the transmission was unknown. Before that, it had been like a few travelers, and so the world reacted by limiting travel and isolating people who had traveled. But that was the day in the US that the first unknown transmission case was identified. And I remember where I was and thinking, this is it.
Yeah, when you mentioned travel, I remember there was some stories about a particular cruise ship, and it seemed like everybody who was on the cruise ship had it, but nobody else did, or whatever.
Correct.
And now suddenly it was starting to spread. What were those early days like? You mentioned in an interview you did with Style that Mercy really came together as an organization to face the COVID crisis. How so? Yeah,
it was overwhelming and it was scary to be on the front lines as a healthcare provider. And it was just really incredible. I think everybody came together as a team. A crisis, which we faced, is a time of tremendous stress for everybody. And in times of stress, cracks show and things can unravel. But that didn't happen at Mercy. Everybody pulled together and worked together. And while we were all under stress, it was shared stress. And so we were able to better navigate very difficult times doing that together.
Jess, give us your perspective. What's your role been for Mercy in combating the pandemic, dealing with patient care? What's your experience?
So my experience has been a very interesting one in that I've seen the pandemic from both sides, both direct patient care and also from more of the administrative side. So when the pandemic began, I was working in the surgical oncology department. So I was doing direct patient care, assisting in surgeries, seeing patients in the office, on the inpatient floor. And the pandemic posed some interesting challenges for our patient population specifically because we had a lot of patients that came to us from out of state. And if you remember in the beginning, there were travel restrictions domestically from state to state. There were quarantines for patients that were coming from out of state. So that posed some interesting challenges for us. We had to adapt and implement telemedicine, which again, at the beginning of the pandemic was not as widely used as we use it now. So there were challenges with insurance covering those visits. Only certain states were allowing it. Sometimes it was tied to whether or not a state had a state of emergency because of the pandemic. So those pose some interesting challenges for us doing direct patient care. And then about a little over a year ago, I transitioned to infection control in the quality department. And I've been heavily involved from the policy side with implementation of some of our COVID policies, our vaccine campaign, specifically with boosters and getting people vaccinated, answering questions for staff regarding duration of isolation for patients and for staff as well, testing questions, just sort of any COVID-related issue that comes up. I'm kind of the point person from infection control for that. So it's been very interesting to see it from both sides.
You know, a question that might normally come up when dealing with a health emergency is, well, have you ever seen anything like this before? Since I assume neither one of you were around for the Spanish flu of 1915, answer to that question is no. So basically, you're dealing with something you've never had to deal with before. Where do you begin?
And you know, that's a great question that we all sat around together and figured out where we begin. In the very early days, we had a hospital-wide command center, and it was infection control. Jess was taking care of patients then, but it was infection control, and it was quality, and it was marketing, and it was finance, and it was HR, and you know, I think we began by, again, going back to that, let's work together and figure all of this out and take it one piece at a time, quickly.
But I know that Mercy ultimately made the decision that you were going to follow the CDC guidelines in terms of what they wanted to say, because there seemed to be, would you agree that there was a lot of misinformation flying around initially about the severity of the disease? You know, was it just like the flu or a cold, or do I need to go and dip all my groceries in bleach, and all this different information that was flying around? So when you're dealing with something like that, I mean, I assume that makes it a particular challenge when you're dealing not just with patients, but you're also dealing with staff who are trying to figure things out.
Mm-hmm. Yeah, absolutely. And, you know, Mercy has always followed the CDC guidelines very closely for any sort of infectious guideline. And we did that with COVID, but the thing about COVID and the CDC was there were millions of questions, and there were very few answers, and the CDC didn't know all of the answers. No one knew all of the answers, and so there was a lot of navigating while following that guidance that still required a lot of people to give it a lot of thought.
Now, Mercy wound up garnering some national publicity through NBC, CBS News, even CNN with Anderson Cooper, when, very sadly, COVID-19 claimed the life of the Mercy's chief of critical care, Dr. Joseph Costa. What sort of impact did his passing have on Mercy, in your opinion, and the hospital's COVID response? And what did it mean to you personally?
I think as an organization, it was a very devastating loss. He was somebody who was so much at the forefront of battling the pandemic for us as an institution. And I think, you know, everyone in the early days of COVID was just trying to weather the storm and get through each day, and losing someone who was so integral to just our response. And so unexpectedly, I don't think anybody really saw that coming. And so that was very difficult as an organization, but I do think that it did bring everybody together in a way that everyone was able to kind of mourn his passing together and support each other through that. But then also it kind of showed how resilient we could be as an organization to kind of not only continue to battle COVID, but come through that huge loss together. And personally for me, you know, I worked with Joe for many, many years, and he took care of a lot of my patients. And he always seemed to bring a very calming presence to situations that were otherwise filled with a lot of fear and anxiety, especially with critical patients. And if I ever had a patient who was on the floor that I needed a consult from an intensivist, you know, to hear his voice on the other side of the phone was always very comforting. It was kind of a sigh of relief, you know, that, okay, Joe's there, he's going to take care of it, everything's going to be okay. So.
Dr. Rowe, did you have any thoughts?
I think very similar to Jess, it was devastating for the organization, a dark, very dark time. In the midst of the time, which was a very challenging time during the COVID pandemic, we didn't have treatments. He was not our only death. There was a lot of death around us in the country, in the world, and at Mercy. And but yeah, it was very difficult. But I think remembering that smile even at the time, and that really positive, always upbeat attitude that he had, I think got many of us through what was probably the most difficult professional loss that we had.
We've mentioned some of the darker moments. What about some of the brighter moments when the tide seemed to be turning, or we felt that would reach some major milestone, or some of the positive moments? Any come to mind?
For me, I think the most positive and joyful day of the pandemic, if there is such a thing, was the first vaccine clinic on Christmas Eve. It was such a gift.
Couldn't have a better gift at that particular time.
Yeah. And such like a hopeful. It was such a hopeful day and moment at a time that is about hope. And I guess my second very positive day was the day in July of 21 that we had 0 COVID patients in the hospital.
How about you?
I completely agree with vaccines. That just seemed when they finally came to Mercy and we had them and were able to get them, I think as an organization, everybody kind of breathed a sigh of relief almost, that now we have this extra layer of protection to help us in fighting the pandemic. So definitely that was a very good day.
We'll take a break and we'll be back after this message.
I love working for Mercy. It's awesome. I love working with the patients. I love my coworkers, my supervisor, my managers.
If I was to sum up Mercy in one word, it would be passion. I love what I do. I love my job. I love helping people. It makes me feel that I'm making a difference.
If I could describe Mercy in one word, I think I would think of family.
When you walk in, everyone's smiling at you, and always feels like no matter what's going on, someone's always looking to talk to you. So it's one of those environment kind of things.
I feel love. I feel love and just care and affection. It's a happy place to be.
Mercy really lives up to its mission to love, to share, to support, and to care.
One word for me to describe Mercy is caring.
Truly, just people care for each other. They care for the patients. They paid for my education, I'm very grateful for that.
They're always trying to push you to get into another role. Before I was a coordinator, I was a tech on the floor. My boss was flexible enough to allow me to go train.
I actually began as a student here. I did my surgery rotation here when I was in PA school, and I love that everyone wanted to teach. It wasn't just if I asked a question, they looked out of their way to answer a question or tell us about the field. It's a huge, amazing teaching hospital.
They're going to nurture you, train you, they're going to be patient with you, and they're going to make sure you're successful.
If I could sum it up in one word, it would be amazing. Community.
Compassion.
Home. Mercy is really, truly my home. There's nowhere like Mercy.